The president, Nigerian Cardiac Society (NCS), Dr. Okechukwu Oga, says about 15 to 20% of heart disease cases in Nigeria are as a result of unhealthy lifestyle choices. He said this in Abuja at a news conference on the Society's 51st Annual General and Scientific Conference. The conference has its theme as Prevention of Cardiovascular Diseases to Surgical Care, Progress, Gaps and Prospects.
In Nigeria, we know that for the adult population, about 33% of them have high blood pressure. And this is one of the causes of heart disease in the country. And this is just the average. In some parts of Nigeria, even 40%, getting bigger, obesity, high blood pressure is becoming commoner. We're having more diabetes in the society. Our cholesterol is going abnormal. We are not eating right anymore. We eat all sorts of things that are not good for us. We are not imbibing those old things we do before, eating more fruits and vegetables. Those are not there. So our lifestyle is changing from the old system we have to the lifestyle you see abroad. And people are having coronary artery diseases.
Oga said that many people with high blood pressure were not aware that they even have the disease and do not receive treatment. A situation, he said, could lead to cardiac arrest or even death.
Poverty can cause cardiovascular disease. And there are many ways we can affect it. One, if you are poor, you live in a poor environment, poor housing, overcrowding, you're at risk of developing one, rheumatic heart disease, as I mentioned. And in poor people, that is where you house a lot of tuberculosis. Some of those things affect the heart as well. It's not only the lungs, and they can destroy the covering of the heart, or even have excess water within the heart. That is one. Number two is that when you are poor, you won't have money to buy good food. So you'll be eating poor food, which are not even good for the body.
The cardiologist said that with the increasing number of cardiovascular disease cases in Nigeria, the ratio of one cardiologist to 10,000 patients is insufficient. According to Oga, the situation may get worse with the migration of health workers from the country.
And we also are using this opportunity to ask each and every one of us to take time to do regular health checks so that you know your status, and also have time to rest as you move, because it's also important. We also want to use this opportunity to let us know that in the next few days, the World Heart Day will be celebrated.